The overdose crisis was declared a public health emergency 9 years ago, but the Ford government still doesn't have a strategy to confront the crisis that we're in. We've witnessed the drug supply become increasingly toxic and unpredictable. The consequences for our communities and the people of Ontario have been devastating. We have lost 7 Ontarians to opioid poisoning each day in 2024. That's 2,244 preventable deaths just last year. And each loss shatters a family, a community, friends, coworkers, peers, and care providers. And the province still has no strategy in place to tackle this crisis. When the closures were announced, the Ford government announced that heart hubs would take their place. But months after the closures, substance use treatment is more difficult to access than ever. Heart hubs have not been given adequate funding or provincial direction to hit the ground running, and as a result, we've seen a net loss of services in our communities. We need to use every tool at our disposal, including harm reduction and treatment, to save lives. The task force would create a leadership and accountability structure that we desperately need, with a clear mandate to reduce the harms of the toxic drug crisis in our communities. Overdose deaths are preventable, but we need to act. In doing so, our communities will be safer for all of us.